Hello, hello. Maybe we should start on time, not waste our limited time with lectures. Welcome to FOTONA Industry Symposium in Bangkok. I'm Daria Schlebinger, working for FOTONA over 35 years, and I'm here in the role of a business manager for the Southeast Asia. So today we have three very exciting lectures for you. The first one will be Dr. Marisa from Thailand. She will speak about microcoding. She's assistant professor, chair and assistant to scientific affairs, and dermatologic surgery specialist. And she's author of many research publications and book chapters. The second one will be Dr. Steven Akihiro from Indonesia. He's a very experienced user with FOTONA devices, medical doctor of dermatology. He has many publications in different journals like American Academy of Dermatology and so on, and he's a speaker on many events. And the third one is, he will speak about Pico Pro laser and his experience. And the third one is Mr. Sam Valence. He has a great passion for innovation and precision in aesthetic medicine, and he's a very skilled laser practitioner. And he has a special interest in utilizing both fractional and full-field FOTONA laser. And he's passionate about combination with layering multiple FOTONA modalities. He will speak about FOTONA for Glow, which is the newest protocol for rejuvenation and prejuvenation. So I would like to invite the first speaker, Dr. Marisa, to the stage.
Thank you for your kind directions and welcome everyone to the FOTONA sessions this afternoon. So it is my honor to be on the stage today. I'm very excited to share my experience on the new tip that I've just recently used a lot. It's 2940 erbium laser fractional that has come into the scanner like a F-runners. So I have no conflict interest in regarding to the presentation. I mean, not besides the honorariums of this talk. So the concept of the microcoring is maybe start from the needle corings that make a hole that big enough to make change to the rejuvenation, to the collagen productions, and also the treatment of the scars. So and at the 2024, the microcoring from the FOTONA companies comes to the market. So what I got. This is since like 2-3 years ago, but I'm recently just used a year ago, and I found it's very, very useful. So it's come into the like a scanning mode. So when you like finding the laser, so they come like this. So what we get from this F-runners, we have like 250 microns with like a pixel from 4 to 168 pixels, and they have varieties of the choice of the energy that we can deliver to the skins. So what difference between these 2940 and other fractional that are available in the market? So we have to consider two actions from these fractional ablative lasers. The first one is the ablative depth. So what we get from this platform, we can have selection of the depth that are available in the device, and also the calculation is minimal. So when we compare with the CO2 laser and erbium 2940, it's amazing that less calculation that we can get from 2940s. What is it good for? With less calculation, we have less likely to have like PIH, post-inflammatory hyperpigmentation, because no extra heat. So this is the depth that we can get from the platform that will start at 30 something like micron up to 500 microns that are available with minimal calculations. And we can also selection of the coverage from 5 to 10 to 20s, because most of the publication mentioned about the density that maximum that we can give to the patient is up to 20s. Because more than that, we can have more likely to get a hyperpigmentation or slow healings. So with this platform, what we get, we can treat varieties of the photo age damage. We can treat even the hyperpigmentation, wrinkle scars, or even stretch marks because of the unlikely to get a PIH. So with this kind of ablative platform, we can select from the skin rejuvenation depth, which start from 50 to 150 microns, or we can treat deep wrinkles 100 to 400 microns, and scar them up to 600 like that. And we can selection of the coverage from 5 to 20s. And the amazing thing that I think is quite different from the fractional carbon dioxide laser is the downtime. The downtime is usually limited to like 7 days, what my experience. So with my settings, so I will show you what this look like. This is the paper from the companies that show that at the beginning, absolutely, because this is an LPM laser that we create ablative but less coagulations. With the less coagulation, what we get is some bleeding on the first few hours of the laser. So I usually ask the patient to stay and to keep an eye on the bleeding. So sometimes they have to remove the bleeding and like to make it dry. And after like a few 4 or 5 hours, it's kind of stables. So after a few days, it may look like bleeding, but after 7 days, amazingly, that it can heal nicely. For facial rejuvenation, the recent paper from the companies show that they have like less setting when I inform in the beginning. So the setting for the rejuvenation only 24 joules per square centimeters. And if we like to treat something like more aggressive, we go to 30 to 40. It's like, so totally agree with this setting from the companies, because when it starts to go up to 50 to 60, sometimes you have to be very careful on the redness and also maybe possible of the PIH. So this is from the companies that show how it heals. So after the beginning, and absolutely every fractional laser, they do have like spots and coagulation columns and bleeding. And after 7 days, it's healing nicely. So they also measure the textures that improve about 10 to 12% in only one sessions. And for the pore size, also improved in 10% as well, according to the papers. And this is my patient. My patient is asking to treat her eye bags. So I do treat her like 2 times, 2 sessions, with like 40 joules per square centimeter settings. The patient told me that the healing is only 7 days. After 7 days, it look normal, and the pain is much less than whatever like she experienced earlier, because this is my patient for almost 5 years. I do fractional CO2 laser for her yearly, like once in a year. And this is the second time, the 4th time that she came to me, and the 4th year, and asked her that it's really saggy. So I like to afford her to provide her something that more extensive treatments. So this with the 40 joules, she's really happy with that. So that's why I can realize that this is the first fractional lasers that patient come back to me and ask for another session. Because, like fractional CO2 is very painful, and the downtime is quite bad, the sad journey for the patient too, and also the PIH. So I found this is amazing that patient asked to come back and to ask for another sessions. This lady has denied from the plastic surgeon because it's already, the patient has ectopion, you can see on the lower eyelids, and our plastic surgeon referred her to see me to see any possible treatments. So I do offer her like a fractional, like our F-runner tips for her lower eyelids. So I'm kind of aware of the treatment that close to the eyelid margin, because it might cause more ectopion. Instead of I do it in close to the eyelids, I go a bit lower and more on the lateral, just to support on the side. So when I test that on the side can support her eyelids, I treat more on the temples. So after treatment, you can see that her ectropion is improved, and she's really happy with that and asked for another treatment. And these are the ladies that asked for the comfort her eye bags and eyelitosis as well. And this is only 1 session. For acne scars, this is a recommendation from the companies that have the setting that we can give to the patients. But in this is my patient that have my acne scars, and I do as a 40 joules that I do for the rejuvenation, and we can see the improvement of the surface. In this case, it's very special because his acne scar is quite deep and like a this box scar, and getting worse when the patient do smilings. So after the treatment, we can see belly by eyes that improvement in the depth. And if we do 2 times, two sessions with a 50 joules per square centimeters, we can see much improvement on the depth. And when he does the smilings, it's less like dimples on his smile. So it's a bit more confidence for his smile. And on the other side as well, after like 1 month after 1 treatment, we can see easily by eyes that improvement. And after like 2 treatments, this is much improvement. No other treatment I given to the patient. I mean, I didn't do subcision, I didn't do other like injection at all. So improvement and mouth time is very acceptable. And this is smiling, so it's less like deep wrinkle line, deep smile eyes. For post-treatment care, so it's always beneath occlusive cream, and also I do given to normal saline to clean up some bleeding spots, and the repairing is really fast. And the patient know how to deal with it, and most of the patient has no like coagulation spot that's seen by eyes. But we have some cases that have like coagulation spot that like like scanning areas. In this case, I would say that she was like sweat during her exercise a lot. She didn't stop to do exercise while after the treatment. So that's why I think the healing is slow and turned to be the redness, swelling, and the coagulation is visible. And after that, after 2 weeks, it's go away. So for take-home message, I do believe that the people like to have a natural-looking results. So for my practice, I do injectable less, but I do more EBD and laser treatments. And the fast healing is acceptable for most of the patient, and downtime journey is important for them. And the willingness to come back is important factors that to count on when you decide for the treatment plan for the patients. For our erbium lasers, micro-covering system, I received the high patient satisfaction. Improvement can easily visible by eyes, minimal discomfort, and minimal downtime to the patients. And also minimal like PIH. I have only 2 cases of PIH that I have treated like many hundred of them. Right. So I think the happy patient is the measuring like factors for the aesthetic practice. Okay. Thank you very much.
Does anyone maybe have a question for Dr. Marisa? Or we ask questions at the end? Maybe at the end. Okay. So the next one is Dr. Steven Akihiro from Indonesia.
Okay. This. Excuse me, remove this one. I think I'm too tall for this. Okay, can we just get rid of this? Thank you. All right, so lovely meeting you all here. So I will title my lecture today, High Energy, but yet with low risk. And let's see what we can do with this device. The device that I'm talking about is going to be the FOTONA PQX. This is my CV. I am from Indonesia, although I was trained in the United States. And I am also a trainer for the FOTONA PQX. So I will start with a picture. Okay, this is the population that you have in Indonesia. You have some really light-skinned people, Chinese descent like me, or you have some really dark-skinned people, akin to like an Australian aborigine skin. So we have a very, very diverse population. But here's the thing. When they come to you, they will tell you that they don't have Landigine's melasma or post-inflammatory hyperpigmentation. But they will tell you that I got these dark spots. Okay, and it's up to you to diagnose and treat accordingly. So since everyone will come to you with some sort of a pigmentary issues, so the market answers, right? Because Indonesia, as you can see here in the previous picture, Indonesia has what we call the perfect storm, so to speak. Population is of multi-ethnicity. And all the skin types have higher risk in response to any energy-based devices. They are at elevated risk of pigmentary disorder as well as PIH as well. And they live in an area with high UV exposure all year round. The only season we have is either hot or hotter. There's no summer, there's no winter. Hot or hotter, that's all we have. Okay, and of course, we have the topical strategies, cosmeceuticals, prescription-grade topicals, and we also have the pills, which is quite useful, right? Because they can help with supplementary issues. And we also have the laser technology that we are probably already quite familiar with, which is the laser Q-switch laser. So the Q-switch lasers are essentially high-energy lasers, okay? But the thing is that high energy usually means high risk. Okay, and this is due to the fact that the high energy laser usually create what we call an excess photothermal reaction, and this forces clinicians to do two things. The first thing, the fear. Okay, they lower the energy. They try to keep it safe, play it safe, and try to lower the energy as to avoid any possible side effects. Okay, and after that they go, I don't see any results. Why don't I just crank it up a bit? Crank it up, go get higher fluence, doing it more frequently. Let's see if we can get some results. And then the risk of PIH and risk of other complications increase. And then there's the ideal case where the pico lasers usually promise. If the high energy laser creates an excess photothermal reaction, what if we can create a device where we have a device with high energy utilizing not photothermal effect, but photomechanical energy. And this is very, very promising because heat is one of the problem with our skin type. And then it became really popular, right? Because it promised high photomechanical energy with very low photothermal reaction and very low risk of PIH and other complications. They use it for pigmentary disorders. Excellent choice. And they use it for rejuvenation or brightening, which is kind of like the bread and butter kind of thing. And also some devices are also usable, also can be used with acne scars as well. And the market hyped it up. Pico laser, everybody started buying pico laser. And if you go outside the exhibit hall, you will see probably 20, 30 different brands of pico laser. And it became some sort of the laser that can do everything. And then I'm going to show you these two pictures that I found from Instagram in a post in Indonesia. On the right side here, you will see that the Instagram post says that pico laser can be used for acne, which is untrue. It cannot be used for acne. This laser is not for acne. So there are claims without evidence. And also there's the cheap pico trap. Some people use a pico and they charge absurdly low prices. $20, $30 for each session. And they started doing it more and more because they think it's just cheap. And this wrong indication and also the wrong platform turns a medical device into a marketing gimmick. So it's no longer a real medical device, but it turns into a more marketing gimmick. So these are the 4 wrongs. 4 wrong indication, wrong parameters, and wrong intervals. And you can learn to avoid the wrong number 1. You can learn to avoid wrong number 2. You can avoid you can avoid the wrong number 3 by learning. But if you have the wrong device, you really can't deliver a successful result, no matter how much you learn. Okay, but we need to really know, right? What is pico really, right? Before we compare device, we really need to know, and we need to really go back to the basic and ask ourselves whether we really understand what pico actually is. So, what makes a laser pico is a pico laser is a device that emits a laser in a picosecond pulse duration. Okay, it's still a Q-switch laser, but it just emits the laser in a much shorter pulse duration. And when you are able to pack a big amount of energy in such a short amount of time, then you can create this high peak power that will eventually lead to the photoacoustic or photomechanical effect. So that's why we have the FOTONA PQX. Okay, this is the laser with a true picosecond laser duration. Okay, it has a 300 picosecond pulse duration. It has 2 wavelengths, 532 and 1064. And the most important thing is that it has the sufficient energy to generate the highest peak power to actually get the photomechanical disruption that we want. Okay, and the reason why 532 and 664 were chosen is that it can target different chromophores, the same chromophores at two different depths. 532 targeting the more superficial and 1064 targeting the more deeper structures. Okay, and if you look at the graph here, right, the 300 picosecond is a little bit much further down to the my right, but your left, okay, which means that it has much more photomechanical effect and very, very little photothermal effect. So the question again is that, is my nanosecond laser obsolete, right? So most nanosecond laser will tell you that they have a post duration for about 5 nanoseconds. And as perspective, 5 nanosecond is about 5,000 picosecond. And on the right there, you see, on your right there, these are the chromophores that you can see in the skin. And if you look further down on the very bottom, you see that the smallest chromophore is actually the tattoo particle, which has a TRT or thermal realization time for about 10 nanoseconds. So, and then we start asking ourselves, 10 nanoseconds TRT. So that means my 5 nanosecond laser should be enough, right? So physics-wise, I think it's quite enough. It's half the time of the 10 nanosecond. So theoretically, it is, but clinically, is it, right? So we look at the studies here, and there are some studies looking at how pico is compared to nano across these different conditions, starting from tattoos, abnorms or horis nevus, nevus of Ota, melasma, and lentigines. And what we can see is that the pico often does it better with much less risk of complication. And the question comes again is that should I upgrade to picosecond lasers? The question is yes. If you see a lot of patients with tattoos, if you see a lot of patients with pigmentary issues, yes, because stubborn lesions exist. There will be patients who you have treated with nanosecond lasers and still the pigment or the chromophore won't go away. And this is where the pico comes in. And furthermore, because the nanosecond laser also has a higher risk of thermal collateral damage, again, because it has a higher photothermal effect compared to the picosecond laser. And also, it has also a higher tendency for rebound in melasma and sensitive cases such as melasma. So, choosing a picosecond laser, right? So again, if you go out there, probably there's 20 to 30 different brands of picosecond laser. And please be mindful that actually creating a true picosecond performance is technically not easy. It's actually technically very, very difficult because the shorter pulse means there's less time to generate energy. It's very hard to pack that much energy into a much shorter amount of time. So some devices compensate by using smaller spot sizes, which means that you can't really go deep. There's more scattering and there's reduction in light penetration. Also, there's also increased risk in complications as well. And then if you look at the comparison on the right, you can see that the picosecond laser by PQX has among the shortest post duration, but among the highest power. And I want to add also that the picture is not made to scale. So PQX is one of the smallest pico laser device in the market, which is very useful, especially if you have a smaller office space. So, and finally, with that, you will have this result that you want, which has a precise targeting to target all these pigmentation disorders and tattoos. So let's have a look at some cases here. Okay, some cases that we usually see from time to time. Melasma, right? So everybody knows melasma, and they know that treating melasma is always challenging. And one of the most common EBD treatment is using a low fluence QS and deactoning. But when we treat melasma, what we're trying to do is that we're not trying to kill the melanocytes. We're actually trying to kill part of the melanocytes, which is the melanin and the melanosomes on the tip of the cell. So it's like a subcellular selective photothermolysis. Remember, we are doing pigment reduction, but not pigment destruction, okay? But here's the thing. Nanosecond lasers have been used many times over because there seemingly is no downtime. right? And sometimes they use it too strong, too frequently, and then complications arise later. And then the complications that you see on the image here is what we call a gutted hypomelanosis due to the excessive use of the nanosecond laser. But with picosecond laser, you can actually increase that margin of safety because its ability to target the tips of the cells, the melanin and the melanosomes, instead of the whole cell. So the risk of having this gutted hypomelanosis will be much less with picosecond lasers. And this is especially true when you have melasma that is very resistant and very hard to treat with nanosecond lasers. So second case, solar or senile lentigo. Okay, this is one of the most common chief complaint. They have this blotch, this dark spot on their face, and then for a lot of Asians, this is especially very concerning because it's so visible against a relatively lighter background. And then if you look at it histopathologically, you see that a lot of pigment are actually located in the basement membrane zone or in the epidermal junction, which means that if you target these areas, there is always a risk that you create an excess damage, and then some of the pigment can go into the dermis and creating PIH. So this is why in nanosecond lasers, the rate of PIH is about 25 to 47%. And again, with the picosecond laser, especially with such a post duration, you localize the destruction of the target. You minimize the destruction of the surrounding structures so that the risk of PIH is also lower. So it's about 4 to 5%. And of course, using picosecond laser with stronger photomechanical disruption, not only it's safer, but it can actually clear it a lot better as well. And then finally, the final case that I want to talk about is the horis nevus. This is almost like a nightmare for a lot of Asians because they kind of look like melasma, except that they actually present a little bit earlier. They're extremely difficult to treat, and they usually darken over time. And then if you look at the right side here, there's the pathology of the horis nevus. The pigment is already in the dermis. They look dendritic, spindly shaped like, and which makes it extremely hard to treat because if you target it and then the destruction is a little bit more than the target itself, you can actually get complications. It's very easy to get complications. So using nanosecond lasers, the rate of PIH is about 54% because when you target it, the pigment in the dermis, it spreads out, it creates the PIH. But for picosecond laser, the risk of complication of PIH is actually half by around 28%. Not perfect, but a lot better. And then I'm going to show you some before and after here. Although this is not perfect, the patient has never experienced any PIH and has a consistent reduction in pigment throughout the treatment with us. And I want to show the final thing that I want to talk to you about is the something special from PQX. This is the DOE or the diffractive optical element. And other pico lasers usually do have a similar diffractive optical element device, and these of diffractive optical element or DOE transform the full beam into multiple tiny beams, increasing the fluence in each of the dots. But the difference is in PQX, the dots, the ILIOBs that are created by the dots are actually much stronger. So they can not only create LIOBs, but they can also create full epidermal ablation, which is kind of like the gold standard of skin rejuvenation. So this is one of the pathologies on your left. You can see some LIOBs that are usually made by regular picosecond lasers. Mind you, we're not talking about counterfeit or substandard pico laser, but legit pico lasers. But if you have a PQX, you can have the option to have a full ablation of the epidermis. So then you can treat even more. You can treat not only pigmentation, but you can also treat some acne scars as well. And then of course we can combine them. We can combine the 1064 black handpiece to reduce the pigment, uneven skin tone, and then you mix it with the, you follow it up with F9 fractal handpiece, which is what we call our DOE handpieces, to create this cavitation, this LIOPs that will induce the synthesis of collagen, elastin, and myosin. And this is what we're looking for. This is the goal of what we want, is that we want the patient to have a glowy look, a tight, thick skin look, a buttery skin look, not this artificial glass skin, shiny kind of look, because that's not healthy, okay? And of course, we want to achieve the ultimate healthy skin. And this is what I usually do with PQX. I use the PQX, the FOTONA PQX, as an echo anchor treatment. We treat the uneven skin tone, the pigmentation issues with the black handpiece. We can also treat make the skin healthier using the LIOP rejuvenation using fractal, and then you can combine it. You can combine it with other devices. Should you have RF microneedling, that will be something that is excellent for someone with acne scars. So FOTONA PQX with RF microneedle, excellent device. Excellent combination. You can also combine it with semi-ablative lasers or even ablative laser, just like Dr. Marisa was saying. So you can combine FOTONA PQX with other things. Also, you can also combine the FOTONA PQX with injectables as well. So you do the laser and then you do the injectables after. Should you want PDRN, PN, PDLLA, CAHA or collagen, whatever it is you want, you can combine them. So this is what I usually do. FOTONA PQX as an anchor treatment, and then combination with other devices and injectables to achieve the ultimate healthy skin that we're all looking for. And then finally is that, remember, Indonesia is almost like a lab to me, with a lot of diverse skin types, multi-ethnic population with high risk of PIH. So pigment laser is always a key part in any aesthetic treatments and in my clinic as well. Remember, making a picosecond laser is not easy. Just because they look like they have the same specifications doesn't mean they actually have the specifications, because none of us, I believe 95% of us, don't have the device to actually check whether a device is up to its standard or not. So when we have the ideal picosecond lasers with clinically useful pigment focus wavelength, the 532 and 1064, a really true picosecond laser duration, and a really high peak power, we can use this FOTONA PQX as a core anchor treatment. So as in a multimodal strategy, so you can achieve, either you want to treat acne scars, achieving a better skin quality, or just overall rejuvenation. And this is how I would try to approach the high risk, the high energy, low risk. That's how I would go with the higher energy but low risk. So I thank you very much. Have a wonderful day. Oh, I think I went over.
Thank you very much, Dr. Stephen. And now Sam Valens from Australia. He will share his experience combining multiple wavelengths of FOTONA lasers.
Yeah, thank you. So, good afternoon, guys. I'm going to start with a confession. I actually said no to this talk. I said no 3 times. And of course, after seeing that very impressive speaker list, I had that familial sense of panic. I think many of us have moments in our careers where we question whether we actually belong in the room or not. Now, you heard everybody's CVs, but you didn't hear mine. I'm an aesthetics nurse from Australia. I'm not an academic. I'm not a dermatologist. So I actually found myself asking, what am I doing here? Then I realized something. For 20 years, I've been looking after real patients, evaluating technology, looking at trends. And during that time, I was carrying one question. how do we give patients meaningful skin improvement without surgery? And today I'm going to share that same question and what I learned exploring it. So in my experience, clarity is a form of kindness, and so is disclosure. This is obviously a FOTONA-sponsored presentation. That said, everything reflects my personal clinical experience, my treatment philosophy, and outcomes observed in real patients. My goal today isn't to tell you what to use. It's to share what I've learned, what has worked, and hopefully provide you with a few ideas that you'll find useful in your own practices. So this is my patient demographic. Let me tell you who walks through my door. I'm on a place called the Mornington Peninsula. It's sun, salt water, a lifetime outdoors, and skin that tells those stories. 3 groups come back to me again and again and again. We've got the coastal lifer, decades of sun. We've got our sea change retiree starting a brand new chapter. We've got the younger local wanting to get ahead. All different stories, different ethnicities, same teacher, cumulative sum. So for some context, I am indeed surgeon directed. I do spend time in operating rooms. So we manage a broad range of patients seeking functional and aesthetic improvement, which I feel provides a unique perspective on skin quality, aging, and patient expectation. So what's interesting is regardless of age, ethnicity or indication, the conversation is increasingly the same. Patients want meaningful results. So these are the platforms that I use. 20 years of devices has taught me mostly what to walk away from. The marketing promises, the machines that gather dust. These 2 units, I never have to apologize for choosing. Now, take note of the darker Fitzpatricks that we can see on the profile to the right. I'm not going to read this slide to you. The key take-home here is versatility. That's just one platform, 2 wavelengths, dozens of validated applications, and not just those restricted to aesthetics, vascular work, skin tightening, and of course from an ENT nurse, snoring. Take a photo if it's useful, and then we can get to the part that matters most, the people. So I'm supposed to talk about foreglow, but I'm also going to talk about coring and how they marry together in my practice. So we've just had an excellent overview of the science behind microcoring. So I won't spend any time visiting the mechanism of action. The key concept is tissue removal and preservation of surrounding structures and facilitating remodeling. What I want to focus on is how we can fit it into real-world clinical practice, how I incorporate them into resurfacing strategies, and where I believe they fit in the future of aesthetics. What's interesting about this and the take-home is, can we achieve tissue reduction whilst minimizing thermal injury? A concept that warrants further investigation, particularly by the people in this room. So while the science is fascinating, the question I keep coming back to is a bit simpler. What does this mean for patients? They don't care about mechanisms. They care about outcomes, skin quality, wrinkles, downtime. For me, that's when the conversation gets interesting. Microcoring challenges us to rethink how we approach skin rejuvenation and resurfacing as a whole. So these are some tiers of microcoring. Depth isn't a dial you set and forget. It's a conversation with the tissue in front of you. Superficial, mid, deep, each one needing something different, a different anesthetic, a different recovery, different preparation of the skin, and a different honesty about what the next 2 weeks are going to be like for your patient. These are generally the 3 levels I work at. Now, for the laser tech heads in the room, I won't spend time reading parameters. I've included them because I think that reproducibility matters. These are erring on your safer modes. She's clearly a Fitzpatrick 1. It's a fairly superficial treatment. I have tried this one on darker Fitzpatricks with success. We'll just have a quick look as to how it goes. So pretty safe. Case study 1. Here we have a mid-tier ablation in action. Somewhat complicated Fitzpatrick. Genetic background was indeed of Greek. He was prone to keloids. History of PIH. However, adequately prepped, adequately managed, post-operatively cared for, successful treatment outcome. These are the parameters that we used. So take note that we used some topical anesthesia. I did in fact introduce a mild oral sedation. We used diazepam a lot in Australia, obviously under surgical supervision, guys. I did introduce some oral steroids, titrated a couple of days post as well, for that anticipated inflammation. This one's my favourite. This is our golden girl. So this woman was 76, no comorbidities, had a little bit of mild hypertension. These are the parameters that we used below. Now, the important take-home here is that healing is not a footnote. It's the part the patient remembers. It's the days at home, the quiet moments, and they wonder if they made a mistake. Hand-holding. The procedure earns the headline, but the aftercare earns the trust. Now, the interesting feature with this one is that we've also added some wrinkle etching or wrinkle grinding. I'm very happy to share those parameters with you later. Healing phase. This is the part that nobody puts on the brochure. I share it on purpose. This is where trust is either earned or lost. With this chap here, this is day 1, day 3, day 5. With our beautiful golden girl, that was day 1, day 5, day 12. So not everyone is a good candidate for this. And here's the hard part. Sometimes saying no costs you a booking. Prep skin's important. Realistic expectations. The willingness to do this in stages. These are the sorts of cases that I choose to work with. Now, this one will be a bit controversial, but I think as clinicians, we should be prepared to have these conversations with each other and our patients. We don't earn the result on treatment day, we earn the weeks before treatment. This slide summarises my process. Assess the skin properly, optimise the barrier, suppress unwanted pigment pathways, prepare the dermis, reassess tolerance, and only then do I choose to proceed. It isn't glamorous, but patients who do the work are usually the ones who get the best outcomes. And this is the bit you're on the edge of your seats for. We use 4Glow in my practice to complement what microcoring can't reach on its own. So we know that once the structure of the stuff is done, patients sit across from me and they still ask those questions. What about my pigment? My pores? Will I actually glow? We can tighten and rebuild with microcoring, but it doesn't quite answer those questions. But FOTONA 4Glow can deliver. These are the 4 steps. I run them almost the same order every time. Clear the pigment, smooth deeper texture, bulk heat, finish with the glow. It's the last step that brings them back every time. Ideally, you want 3 sessions, 4 to 6 weeks apart. Expect some mild redness, transient pinpoint bleeding, skin scaling, a little bit of itching. This young lady's in her late 30s, a little bit of mild diffuse redness, a bit dull, lackluster skin. 2 treatments, 4-week intervals. Actually happy she didn't want a 3rd one. She will see me for maintenance once every 6 months. The parameters on your right are actually the ones I used. Case study 2. Now this is exactly the sort of patient I was describing at the start. One of our coastal lifers. Time in the sun, life by the water, walks on the sand. Great way to live, but her skin's kept all the receipts. We didn't choose a dramatic change overnight. She had 3 treatments of a foreglow, staged and spaced. The only variation in parameters here were increased with our max Q to about 8 joules, 2 passes. Obviously a little bit more bleeding, but the point is it's customizable. You can play. These are the tools that we've got. Another patient, another honest result. I desperately wanted to core this lady, but she was happy with the glow factor that she decided not to. I addressed her concerns: pigment, tone, texture. We staged FOTONA 4Go across 3 treatments, final picture taken at week 12. Same parameters. Now I want to talk about combining them both. This is the clinical reasoning adopted in my practice. And it all starts with what we're really seeing in a patient. Not just the skin, the person. What we combine, in what order, how blunt the conversation needs to be. It all follows from one act of paying attention. Maybe it's one, often it's both. But this framework helps, but by seeing what comes first. Here we've got a great combined approach. The parameters that you see below are actually what I used. 58-year-old, Fitzpatrick 2, postmenopausal, doesn't take any medication, not on HRT. Primary concern, photoaging and laxity. Patient goals, I want my skin to match my energy. And I don't want surgery. Coring, 6 weeks, foreglow toning, 3 treatments. That's about 8 months later. This is actually what a real stage program looks like. 59 years old, no comorbidities, is on HRT. We did do 2 corings, both at 600 UM. What was interesting is that we were able to play around the eyes, which was quite interesting, which Dr. Marissa alluded to earlier. So after all the science, protocols, and case studies, I want to tell you what this program has gone and done for me. It isn't a number. It's a conversation. It's a conversation I couldn't have before. And an answer to the question I had for 20 years. How do we give patients meaningful skin improvement without putting them through surgery? So this is the most important thing I'll say. And here's what I tell every patient before we begin. This is a program, not a procedure. Sometimes there's downtime. Healing matters. Results come over months. And patients are something of us all. We can't replace surgery, and when someone needs it, we have the courage to say that. And the evidence is still being written. And we work with the literature that's supported today. So 20 years ago, I thought my job was to find the perfect device. What I've learned is that patients aren't looking for that. They're looking for someone who can tell them the truth. The truth about what is possible, about how long and meaningful change can actually take. These tools, laser microcoring and foreglow, have given me tools that I can trust. But most importantly, they've given me the ability to have that conversation honestly. And there's some references for your interest. Thank you. Tough act to follow two dermatologists, guys.
Thank you, Sam. You survived. Congratulations. Excellent. So you heard 3 different lectures, 3 different topics. Microcoring was overlapping, each one expert on their own field. So do you have any questions for any one of them? We have a few minutes left. Otherwise, I bore you with FOTONA history. Don't let me do that. Ask questions.
Ask the dermatologist, please.
You know, each one of them covered a topic, but the beauty of FOTONA laser is always in a combination. Double wavelength in one device, each wavelength, different pulse durations, combining different devices, multi-layering, planning, at the end, of course, the happy patient. But still, those who are working with the laser, maybe if you have a detailed question, or maybe you stop by the booth later, or maybe you send an email to FOTONA, we will get an answer for you, but use the opportunity now.
Maybe one of the most common questions.
Maybe Dr. Stian, come here, continue. And maybe, please join Dr. Marisa and Sam, join us on the stage.
I think one of the most common questions, so to speak, or advice, I think, for starting a dermatology practice is that which lasers do we need to buy? I think that's also very important because lasers, am I loud enough? Because lasers are expensive, right? They're not cheap, right? So what do we need to buy? What kind of lasers do we buy? And also, you know, how can we approach this and what sort of device do we need and how do we learn this device so that we can actually deliver really successful results? Because, you know, in the exhibit hall, you will see cheap lasers, you will see expensive lasers, and the question remains is that, what are the differences, right? What are the differences? So maybe Dr. Marisa, maybe Sam can, you know, tell us how would you approach, how was your first decision in buying these lasers?
Hello, this is me first. Thank you. Yes, easy for me. So, first of all, I like to see how the proportion of the problem of the patient that come to see me, how the age group. So if like the more younger the age group is more likely to focus on acne scars, something like that. If I go for something like the older age group, so more rejuvenation, more injectables, things like that. For actually, as I'm working in the faculty members, so we have varieties of the patients group. So for me, is if I could focus on the specific indication, I select the one that give more opportunities to develop more protocols. So when I'm looking for the acne scars, I start using the FOTONA lasers in the past, like with just I cannot remember the name, but Dualis, something like that. And later on, I found that Dynamis is very versatile platform. So we can select from the non-ablative to ablative. So I can catch up the group that have mild severities and to the more like aggressive, like acne scars. So first of all, I think for selection of the laser, I focused on what my patient problems, and then focus on the thing that I can choose varieties of the application to the patient, and the one that have good publications, you know, like a good evidence base that I can rely on. That's my practice.
Hello. For me, it's a couple of adjectives. Safety, efficacy. What does the research say? These machines are continuously evolving, and that's what you want in a device. I alluded to machines collecting dust 10 minutes ago. These units are not going to. You need to know what you're doing to use them. They're versatile. You treat what you see, not what the machine tells you.
Thank you very much. That's excellent moment to share with all of you. You know, FOTONA established in 2007 Laser and Health Academy. So all the knowledge of FOTONA experts, clinical studies, clinical bulletins, all the knowledge is on this platform, and all of you can access in a limited way, but when you buy a FOTONA laser, you can access to all the knowledge that is accumulated from all around the world. So welcome to use it. Welcome to use it. Mr. Stephen, you want to add something?
I think it took me a while to try to buy this SPDMA. So that was my experience. It took me 2 years to think, because the machine is although very versatile, but it also has a very high learning curve. It's not easy to use. It's versatile, sure, but it's also very hard to use. So you really need to learn, and FOTONA has provided you with the tools for you to learn, and very conveniently, right? Online, right?
Yeah, it's online, it's alive, it's individual, it's basic, it's upgraded, it's per indication, per language group. So we design everything, and we try really to support each one of users to use it properly and more, as Dr. Marisa said.
And there's no
it's evolving.
consumables. No consumables.
No consumables. Yeah, that's commercial.
Yeah, I do have the SP Dynamis, which I recently bought. I'm a user of Ultra Pulse Luminous. I'm new to the FOTONA. I've been having the Ultra Pulse for 14 years. So how would you rate an erbium to a fractional CO2? Because what I understand, the limitation of the erbium technology was uncontrolled coagulation and ablation, which was the minus point, which was comparing to a fractional CO2. I understand the latest one has got more controlled ablation so that you peel off every layer in a controlled way so that the PIH on an Asian skin is much, that's the most dreaded thing when you treat an Asian skin type. So I just want to know your opinion about what do you think, in your opinion, about an erbium, 2940 versus a 10,600 fractional CO2.
So may I? Because this is my topic, talk about 2940s, right? 2940 is kind of erbium that is best absorbed by water. So that's why we can control the depth of the penetrations. So the heat around is kind of absorbed by the water in the tissues. So, and the way that they deliver the energy to make a ablative hole, they do like MSP, very, very short pulse, and let's stack like a short and run it together like a train pulse. So we can determine the depth by the stack pulse, number of the stack pulse like that. So it's very, very like exact in the depth that we get from this erbium FOTONA platform. So, and coagulation is the other thing that I'm really impressed, because a coagulation can cause PIH, right? Extra heat on the side causes a coagulation on the side, causes the PIH. This is less coagulation, so that's why after the lasers, we got the bleedings. And the amazing another about coagulation is because of less coagulation. After the procedures, that minimal spots of the scab on the skin. And the patient is barely seen it. Sometimes we get set low settings. So really impressed with less spots, so it can easily go to work and is less likely to cause the PIH.
Just a follow-up question. So what I understand is, see, when you're doing a fractional CO2, by the time you reach the fourth pass, it comes in contact with the water and gets neutralized. There's no point stacking more because you're just charring and burning the skin. So over here, what I understand is every time you go to a particular depth, there's an ablation. So stacking actually increases the penetration. The more you stack, it goes more deeper.
Yes.
Yes,
Perfect.
but
Thank you.
less absorption on the side.
Thank you.
Because, FOTONA is producing erbium yak for many, many years, and we really master this technology. We can produce very cold ablation, totally cold, or hot ablation with coagulation. We can ablate deep without coagulation or with coagulation, and all these depths and temperatures are under control. Or we can have erbium yak smooth which is non-ablative because it pushes, the train of the pulses is pushing temperature into the depth without ablating the superficial. So erbium YAG in FOTONA hands and in your hands is under control and safe.
Thank you very much.
So now it's 3 o'clock, maybe final word, very short, and then we need to leave the stage to the second other group. Okay, so thank you very much for your attention. And welcome to the booth. Thank you to the lecturers, Dr. Steven, Marisa, and Sam. Thank you very much.